Very, very warm welcome to all our guests and our panel members to the NHS SWL Measles, Mumps and Rubella, otherwise known as MMR webinar. My name is Ima Mir. I'm the CEO of the Asian Resource Centre of Croydon, but I'm also the chair of the Voluntary Sector Leadership Board that is through the One Croydon Alliance. I'm very pleased to be able to chair the evening. I hope you were able to enjoy the brief heatwave we had last week, and which has now been replaced by rather milder conditions, I would say. And many thanks for sparing the time to join us this evening for this very important session. I'm a parent of 2 young children myself, and I've had both of my children vaccinated because I know from personal experience how painful and dangerous these diseases can be. As we approach winter, the topic of vaccinations becomes very important and urgent, and we really have a very informative hour and a half ahead. Saying that, let me tell you the aims of the session. So we want to provide parents in South West London with information about the MMR vaccine. We want to tackle misinformation about the vaccine and to answer as many questions as we can by a very qualified panel that we have here tonight. Let me take you briefly through the agenda. So we will be looking at the content of the measles campaign in South West London. We'll be looking at what is the MMR vaccine, how can you get your children vaccinated. We'll be looking at some of the key concerns that people have, and hopefully we'll see a case study or hear from a local parent, and we'll also be looking at some Q&A. We're taking some Q&A. You will get a chance to ask questions to the panel, and if your questions cannot be answered, let me assure you they will be taken away and they will be answered after the event. This space is really about responding to questions, and attendees can use the Q&A function to ask any questions that you have. And let me just let you know that repeat questions won't be shown. So if your question is a repeat, then you can expect that question won't be shown. Next slide, please. So I said we have a really brilliant qualified panel, and we really do. We're very privileged to have amongst us tonight Dr. Darren Rasenge, who is a consultant paediatrician and clinical lead for Healthier Together. We have our very own Rachel Flowers, who's the Director of Public Health Croydon. We have Fiona White, who's a nurse for Merton and Wandsworth, and we have Julie Henn, who is from Croydon SAIS. I hope, Julie, you'll be able to break that down and say what it stands for when you speak. And we have Ruth Eager, who's Head of Immunisations, Project Management Office and Planning, and South West London Programme Team. Before we move ahead, let me do a little bit of housekeeping. So please keep your microphones muted whilst others are speaking. It's polite for everyone, and we all want to hear each other, so it's better that we stay muted while others are speaking. Feel free to turn your camera on or off, or keep it off if you like. Raise your hands if you have any questions. There is a way of telling the order of the questions, so I will go through that order that comes up and shows me who was first. Please do not interrupt. The chair will invite you to speak when it's your turn, and please be respectful of others' views. I know there can be some very strong views, and I'll just give you a little brief warning that if there is disruption, we will politely remove you from the room so that we can continue the session, and it's really informative and fruitful for everyone. The webinar will be recorded so we can share it as an aid for parents who couldn't come. Please keep your camera off if you would prefer not to be recorded. Right, straight away, should we do something interactive? Let's do a poll, and I know Aman has put something together for us. Even I don't know what this poll is going to be, so I'm going to try and answer the question myself, but should we go to our poll, please, Aman?
Hopefully it should pop up on the screen now. if it works.
I mean, I'll leave you to tell us if the poll is working because I can't see it on my end. But can I just comment, we've got a good number of people in the room and I'm hoping that others will join us. It's really, really important that we get these messages across and these opportunities that our specialists have come together and offered to talk to the public. We need to take full advantage of that. So if you've got family and friends that you can quickly drop a text and say, come online, do that and get them to join in. You don't have to register any longer. You can just join from the Eventbrite link.
It should have popped up on the screen. If it's not, it might be because the text's not working, I'm afraid. But I can pop the question in the chat for people to answer.
Okay, so I'm not sure if we've got any indication from the public as to whether that has actually worked. It's not popped up on my screen, but that may be because I'm
it's
on.
Not worked.
It's not
worked. It's just got all you've got is a presentation with poll in it. There's nothing else in there.
Okay, so Rachel.
I think it might have worked on some. I've got a team which says poll, and when I click on it, it does do something on the side as well. So it might be a mixed group. I just wanted to say that it might in some, but not all.
Okay, I'm just trying to click the poll button myself to see if it comes up. It's not worked for me, but saying that, Rachel's just said it's worked for her. So, Aman, if you wouldn't mind putting the question in the chat as well, so people get an opportunity. Okay, so it's working, 67%. Sorry, somebody just wrote down and it disappeared.
It's now saying 71% both first and second dose, and 29% the first dose. If you look at the top banner, there's a polls icon. If you click that, then the results should appear on the side.
I'm clearly having some IT issues and I have to apologise for that. It may well be my laptop that's playing up. So thank you, Darren. If you wouldn't mind just repeating the final figures, then the group will know.
Of course, we got one further response. So 86% now for both doses and 14% for one dose.
Do we have anyone come up with no doses at all?
No. Well, there's one now, so it's changing. Maybe do we want to give it a little bit of time to?
I'm going to give it 1 more minute. So if you can and you're answering the poll, thank you very much. I know some things are coming up in the chat. I am also disabled from the chat function, so I can't actually see that either. I'm totally reliant on my colleagues here to tell me what the results are. So my understanding is that the question was, has your child received an MMR vaccine? Yes, only first dose. Yes, both first and second dose. And no were the 3 options. I think at the moment we're seeing 80% have received both doses, 10% have received 1 dose, and 10% have not taken any doses. Is that right, Darren? Is that what you're seeing?
Yeah, we've got 10 responses so far.
Fantastic. We have 28 people in the room, so I'm hoping that's going to go up. I'd really encourage you to let us know. It doesn't matter, nobody's judging. We just need to know what the situation is of people in the room. So please do answer if you can. Okay, so we'll conclude at that point then. Darren, if you wouldn't mind telling me what the final figures were, please.
Yeah, so it's 1 dose being 20%, 2 dose being 70%, and no doses being 10%, with 10 responses in total.
Thank you very much. So we still have a few people who have only taken one dose and at least one person who hasn't. So the idea is to try and get as many people to take both doses for the vaccination to be most effective. Saying that, really, I'm not the person to give you that advice at all. It's our next guest, who's our panelist and our Director of Public Health, who is Rachel Flowers.
Thank you very much. I noticed that Fiona's got her hand up. I don't know whether you want to make a point, Fiona, or was that kind of...
Sorry, it's an error. I'll take it down.
No, it's okay. I just wanted to make sure around this. So thank you very much for ringing in today, and for those people who are watching around this. So a little bit of context in terms of why we are pushing around measles campaign at the moment. So the UK Health Security Agency, kind of or called UCSA. So these are the National Health Protection Organisation, have done some modelling, working out that unless we have an increase in terms of vaccination rates across London, London could see a measles outbreak of tens of thousands of cases. Now, and I think that this is partly because London, and it's not just Croydon, it's pretty much every borough of London has a low vaccination rate over several years. Croydon certainly has a low vaccination rate. It's been impacted by the COVID-19 pandemic, particularly in some parts of London and in some community groups where the first dose of the mumps, measles and rubella for 2 years of age is as low as 69%. Can't read the question. No, actually, in relation to this, there is a very important factor in terms of population health. It is called the herd immunity. It is basically that if we have 95% of a population vaccinated against a certain condition, they are likely to protect the 5% of the population who cannot have a vaccination for many reasons. London has not managed to get that 95% coverage. And as you will hear, as we've said, is that measles, mumps and rubella is a 2 vaccination process as well, so that we know that unvaccinated children, actually and unvaccinated adults, but we're focusing on children, are susceptible to risk. And, there is a group of 19 to 25-year-olds affected by unfounded stories, and then kind of early 2000s around vaccination, which our colleagues will be talking around this as well. But also adults can be affected by measles as well. So as part of the continued effort to protect people from getting measles, the NHS has launched this campaign to encourage people to check their vaccination status within targeted outreach groups in London. Now, as a Director of Public Health within Croydon, I have seen 3 cases of measles within Croydon this last year. So at the moment we've got low numbers. In 2019 we had a sizable outbreak of measles where over 100 children and some adults had measles. It's a very contagious condition, and without exception, the people who got the measles have either been not vaccinated or only had 1 dose of the MMR. So this is the context about the importance around this. This is about protecting ourselves and protecting children while we are seeing an increasing amount of measles happening within London, not at this time within Croydon or indeed southwest London, but because it's so infectious, and as we're coming back to school where children are clustering together, the risk of transmission is much higher. So that's the context in terms of the measles campaign. Chair, and back to you, America.
Thank you so much, Rachel. And that was really a comprehensive context about the measles vaccine. You spoke about herd immunity, and we're not quite there in London, and that unvaccinated groups are more susceptible to disease. And at the moment, we've got quite a low number, which is 3, but we do not want to go back to 2019 and go back to the hundreds. So let's keep it as low as we possibly can. Thank you so much, Rachel Flowers, for now. And you're on our panel, so I'm sure we'll hear more from you. Next, we're going to our second speaker, who is Darren Ranasinghe, and he's going to talk about what is measles.
Hi, thanks very much, Emma. So the success of any vaccination program means that there's less institutional memory about what the diseases are that we're trying to prevent. And there's more of a focus on the worries of side effects and complications from vaccinations. But these are really devastating diseases, and that's something that's been lost by professionals as well as the public, of how devastating they are. And when you compare morbidity, and that's how unwell children and adults would be within our parts of the healthcare system, that is a well-developed healthcare system, compared to the more developing world, you can get a real sense of actually how devastating things were for us not so long ago. You know, within our lifetimes, for a lot of us, we saw high rates of children and adults getting these infections, and high rates of them being severely unwell with long-lasting effects, and unfortunately a significant number of children and adults dying from this. So measles, they're all important diseases, but measles is the main one that we worry about. It's an infection that spreads very easily. So if you have 100 people in a population, and you all and they were all exposed to the measles virus, well, 90 of those people would actually get the virus. So it's really infectious. And of those, 7 would be severely unwell with complications from those. And there can be really significant things that they're going to suffer with. But the mainstay symptoms would be that an adult or child will have cold-like symptoms, and then they get a rash. But some people, they don't really get much at all. And you may see spots in the mouth as well. So there's a classic kind of syndrome that we look for. We do a lot of education. I train my trainees, and as part of the programme that I run in South West London, we try to reinforce education for UK trainees of things that they've only seen in textbooks, but what they will very much see in real life because of emerging rates of infection coming through with poor rates of vaccination. So there's a classic prodrome that we look for with cold-like symptoms and a rash that's a confluent type rash, and then particular spots in their mouth. But it can be a quite variable presentation in a lot of children. I talked about how 9 out of 10 will pick up the infection, and how a significant number will be unwell. For 1 in 5 children will be so unwell that they will need to come into hospital. So they will need support for their infection, and 1 in 15 will develop those serious complications, and they can be neurological complications that will be long lasting. And this also includes meningitis and blindness. There's no real medical treatment that we have for measles. It's supportive treatment for children if they come into the hospital. So really the best strategy that we have is vaccination, and it's really devastating, this infection in the UK. In a well-run health system where we do have high rates of vaccination, then we would have 1 in 5,000 children still dying from measles if they caught it. Worldwide, in a developing setting, it's 1 in 100. So that just speaks to how easy it is to catch it and how devastating it can be. Do we have another slide following that, Ina? Okay, great. Am I handing back to?
Your next slide will come straight after this one, Dr. Ranasinghe. So just going back to, if we could have the previous slide for a second, please, Aman. Thank you, Dr. Ranasinghe. I think it's, you know, it definitely gets the message across about just how devastating the situation was with the high rates that we were experiencing in recent times, how infectious the disease really is and how severe the effects can be. Thank you very much for telling us about your training programme, which I'm sure many trainees are benefiting from. So we'll hear again from you in just a short while at the Q&As, but if I can move on to our next speaker, who is Julie Henn. And you're going to talk about the MMR vaccine and its effectiveness.
Oh, yes, I was going to just briefly talk about the MMR vaccine, but really about how you can get your child to have the vaccine in Croydon. So as we have heard before, the MMR vaccine is safe and effective combined vaccination. So it combines measles, mumps and rubella protection in one injection. It's given as 2 doses. The first dose is given when your child's about 1 year old, and the second 2 years, 3 years and 4 months of age. So just before they start school, they have it alongside another vaccine, which is for tetanus, diphtheria, polio and whooping cough. And the MMR vaccine does provide the best protection against measles, mumps and rubella. Getting vaccinated is the best way to protect your child. As Rachel said, 2 doses. It's very important. You get much better protection if you have both doses. Over 20 million cases of measles have been prevented since the start of the measles vaccination programme in the UK, and that equates to 4,500 lives have been saved as a result. So that's 81 lives a year, which has got to be a good thing. And the source there is the UK Health Security Agency blog. I'm sure that all references will be available to you afterwards, and it's free on the NHS. So next slide, please. I think I've said it's very effective. Definitely you need the 2 doses. About 99% of people be protected against measles and rubella. Around 88% of people be protected against mumps. This is for the 2 doses. And after having the vaccine, you develop that protection about 2 weeks after having it. Okay, next. So you said at the beginning, SIS is School Age Immunisation Service. We offer all the vaccines in the childhood schedule to all children in Croydon schools. So I may well have met some of your children in the past at one of the schools, and hope to meet some of them again soon. What we're doing is we're trying to just really make it as easy as possible for you to get the vaccine. We generally do, at the moment, we do vaccinations in school for our general programmes. We're trying to look at how to make that easy for you. We're looking at doing some after school vaccination sessions. We will be contacting everybody who has shown to have an outstanding vaccine. So you will get a call, and the call is for discussion purposes, for information, to tell you how to get the vaccine, to tell you how to check if you've had the vaccine, and we can help you with that either over the phone or if you come to one of our sessions. We have evening and weekend clinics. Again, we'll contact you, you can book or you can just walk in, and again all those dates will be available to you. And we're looking at having some at the end of school sessions, so when you can pick up your child, if it's easy for you just to pop in, we will have pre-arranged this and we can put the vaccine there and then. We just want to make it as easy as possible, so any suggestions anybody's got about how you think we can offer it and it makes it easier for you to do, please do let us know. That'd be really helpful. So yes, to finish really, we will call you and we can have that discussion and we'll take it from there and we'll give you the options. So thank you.
Julie, thank you so much. That was fantastic to be able to understand a little bit more about what MMR is, the effectiveness of the vaccine and how we can get our children vaccinated, which is extremely important to know. It's great to know that people will be contacted with information. And I'm sure the contact information will be at the end of this session anyway. So I'm really keen on getting people involved in the Q&A session and hearing from others. So we will move on to back to Darren Ranasinghe for the next slide, and then we'll start thinking about the Q&As. Thanks, Darren.
Thanks, Emma. So, as Rachel mentioned before, there was a paper that was published a number of years ago by Andrew Wakefield that has sparked a lot of controversy and proposed a link between the MMR vaccine and autism, or a new diagnosis of enterocolitis, a bowel condition, and autism. And there was a series of cases, a few cases that were published, and what ultimately was found with that paper was that the results couldn't be replicated at all. And there's a very robust and extensive process for any study that's published, and that raised flags, and it triggered a review into the study itself, where they could see that there was falsification of the data that was submitted as part of the publication. And when doctors went back into the samples to review the data that was submitted, they found that it was completely fabricated. So that's looking at some of the histology samples, but also looking at the cases, and in terms of the children that were developing features of autism. A good number of those children already were developing those clinical signs before they'd even received the doses as well. And so there are a number of things that were quite obvious when they started looking into that publication. And then aside from that, they could see the financial benefits that this person also was ultimately going to receive, more than $40 million worth from purchasing testing kits, from the controversy of sparking alarm into people wanting to know whether their child might have this condition or not. So it caused a lot of controversy and a lot of worry in parents, and it led to not just the UK but other countries experiencing a drop in vaccination levels. And so a lot of work has been done to fully explore any link and address any concerns with the MMR vaccine. And there are so many publications, and you can see the list that's published within the link here, that have completely discredited the initial publication that sparked this, and have demonstrated that there is no link between the MMR vaccine and autism, and that it is entirely safe to give. And that's really what we're trying to convey here, and signpost you to where you can get reliable information. And as I was saying before, that with the success of any vaccine program where we don't see the diseases as often because the vaccines are doing the job there, it's difficult to balance the concerns with something that's been over amplified within social media and misrepresented. So there's a lot of misinformation about MMR, and that stems from that initial publication, and there's a lot of work that we've been doing as a medical community, a public health community, to try and allay those concerns. And it's important that we empower parents with the information that they can review themselves, and there's an excellent program that we've got signposted here, the Vaccine Knowledge Project from Oxford University, that outlines all the different studies that have thoroughly looked into this with an open mind to see, is there any link with MMR and autism, to provide that reassurance for you. Next slide, please. And then the other concern is with the side effects in general, aside from autism. Thank you very much, Fiona. You've posted lovely links in the chat there. We've just picked out some of the more common side effects that we normally advise parents about. It is a very safe vaccine to give. We've been using it all over the world and for many years, so we've got a good knowledge profile of what are common, less common and rare side effects of the vaccines, and you'll be told about these when you go and have your vaccine, but the ones that we wanted to bring out for you are listed here. So it is mostly just mild side effects that your child will experience, and they don't last long at all. As with any vaccine, where the needle goes in, the skin will look a little bit red and swollen, and it can feel a bit sore for a few days, but it will go away. After a few days, then your child can be a little bit unsettled. They can get a temperature, but again, it would last for a few days, and that's part of the vaccine response, and it will settle and they should be fine. Some children might cry, and that's understandable, and all they need is a cuddle. So like with any of the other vaccines, similar kind of side effect profile, and a lot of work especially has been put into MMR vaccine to understand all the different relative risks for this, so we know that it is safe, but we've highlighted those here and those in the chat for you. And as we're trying to kind of reinforce with this, it's why we are giving the vaccine, why it is so important. So recognizing that it has high rates of morbidity and mortality, and you know, I'm blessed to have experience working here in the UK, but also working overseas, where unfortunately I have seen children where their health systems aren't set up to be able to give a strong vaccine system. So even those children that have had vaccines, if it's ineffective because of their cold storage, etc., then they won't have the effects that we take for granted with it, and so they do unfortunately experience the complications that we see in textbooks, and hopefully we aren't going to be seeing if we can get our vaccine rates up. Thank you.
Dr. Ranasinger, thank you so much for speaking around the concerns that we've heard from parents. You've addressed some concerns and misinformation and bust some myths there. And as you say, the vaccination is safe. I think it's really important to reiterate that people should ask a professional if they are unsure, and check reliable sources. False information and misinformation can spread very, very quickly and be dangerous, leading to higher infection rates and even really some very drastic outcomes for some people. So please do check reliable sources. Thank you very, very much to our panel, and I know Dr. Ranasinger, you're going to come back again with another slide, but for now, I just wanted to open the conversation up a little bit and think about hearing some stories, potentially some live case studies of people's experience where they might have had their child vaccinated and why they chose to do that. Let me go to our members of the public who've joined this. Our guests are, thank you so much, Aman, for opening up, and so we can see some faces. I know all the guests have been asked to turn their cameras off, and I'm going to go to you now and ask anyone who chose. I know we said around 80% of people, didn't we, that had 2 vaccinations. What made you get your child vaccinated, or in the case of somebody who hasn't, perhaps what's the barrier, what's the worry, what's the concern that you might have had? Is there anyone that would like to answer that question or come in and tell us your story? I know I'm going to get silence in the room, but I'm a bit of a stubborn old chair. Oh, here we go. Look, we've got somebody already, which was quicker than I expected, actually. So I really appreciate that. Actually, it's Elizabeth Ray from Croydon Health Services NHS Trust. Elizabeth, do you want to come in?
Hello. Yes, sorry, I thought I'd just share with you my experience. So I have a 20-year-old who has only had 1 MMR, and that is as a result, as we were discussing about the Wakefield cohort, and we kind of got caught up in that that anxiety about whether to go ahead and have a second vaccine or not. And so in the end, we went with a single measles vaccine, which of course is difficult because you couldn't get a single mumps and you couldn't get a single rubella, so we could only do the measles. And now I'm in the situation where I have a 20-year-old who's only had one MMR, and I know that probably the right thing to do is to, now he's at university, go ahead and give that second MMR because you know, of the risk at university. So I just thought I would just tell you about my experience, because, you know, it really did happen. We were affected. And just as a sideline, my son does have autism, which I know was nothing to do with the vaccine, because definitely the signs were there when I look back prior to him having that first vaccine.
Thank you so much, Elizabeth, for sharing that story. And I know autism is quite a concern amongst the community, where they feel that the vaccination might have, and I without bringing in other aspects, but I know the same for the COVID vaccine, same for vitamin K, these kind of worries about it potentially leading to other major side effects and for children. I've got Rachel Flowers who's put her hand up. Please come in.
So thank you, Elizabeth, for being so honest. My father had autism. I have autism. Both my sons have autism. Both of them have MMR, kind of had the MMR. I haven't always been a director of public health, so I kind of like came from a non-medical, kind of around this. And I looked at the evidence that was available around this. I spoke to the health professionals. I was checking out what the Wakefield document was, and it didn't stack up in terms of this. I understand why other people did, kind of, but I think that one of the things we learned from COVID, it's about where you get your information source. So if your friend tells you, unless they happen to be a friend like Darren, who's got clinical experience around, in his professional opinion around this, unless you've actually checked the source around this, then please do check the source, because it's so easy to get caught up with that. And I remember kind of like the pressure that I was under from my friends to actually have both. So I think the thing is, in relation to this, Elizabeth, kind of, it is difficult. I chose to go for two. Both my boys had shown signs before, but it was hard. Like I said, I haven't always been a director of public health, so I do know the dilemma around this. So just check the source. And actually, we've seen that links around this is there are some really well evidenced clinical source where you can make the decisions around this. And I think that actually, as has been said, people forget, thank goodness, how dangerous measles can be. Thank you.
Thank you so much for sharing your very personal story, Rachel, as well. Let me tell our guests tonight that now's a really good time to pop your questions into the Q&A function, because we are very shortly going to go to Q&A. We're still talking about case stories at the moment, but it'll be a good opportunity for us to also take some questions. So start popping your questions in, and we will do our best to answer. I know, Ruth, you've got your hand up. I'd love to bring you in at this stage.
Yeah, hi. So mine is also a personal story. I work for South West London IMS and planning. I have two children. Both have been vaccinated with both doses. However, my eldest, before she got her first dose, also contracted measles. She was called for her first dose when she was 12 months old. She was born on the 22nd of December, so it was Christmas time and we were going away. So we booked her first dose in for the end of January when we got back. When we came back from the holiday, she contracted measles. So, and I was still breastfeeding at the time. And one of the myths around that stage was that if you were breastfeeding, your children would have some degree of immunity from things. So I was fairly confident I could delay her MMR. We came back and she had measles. Now, I have to say, not many people at that time really knew what measles looked like, because even then, back in 93, 94, the cases of measles had reduced because people were getting vaccinated and had been for a while. So as a young mum in Croydon and without my parents close by as well, facing it, I have to say my daughter was very ill. She was very ill. It went from a cold to a rash, and a rash that covered her entire body. Her abdomen was just one big blob. Obviously, I was in contact with the GP. Her temperature actually reached, I'm going to use old money now. So her temperature reached 104 at one stage, and that was with Calpol, paracetamol. And I was actually at my wit's end, you know, trying to keep, I actually had to go back to breastfeeding because she was that distraught and she was needing hydration. And it was, I know, almost unavoidable. She was due for her vaccine, but we'd gone away. And I have to say that I never ever want to go through that again, ever, with any of my children. I can't, even now when I'm thinking about it, I actually feel a bit, because I can remember sitting there one night with her. She was wrapped up in in wet blanket, in a wet towel, to try to keep her cool. And even now I just feel a bit wobbly about it. And we forget that when people get measles, it isn't just a rash, it isn't just a sniffle. Children are very, very ill, even the ones that just recover and go on to be quite normal. And, you know, my daughter hasn't had any side effects or anything as a result of it. But, you know, for those 3 nights when she was quite seriously ill, it was a very anxious time. So I just thought I would share my experience, because not many people see measles these days. Not many people recognise it, and not many people remember what it's like to actually nurse a small child with it.
Thank you so much, Ruth, for sharing that. And I think it really hits home when it's a personal story like that. And I actually recall a family member getting measles and mumps at home, and it really put the fear of God into me, seeing them in that state. And so I was very quick to vaccinate both my children. I would absolutely, you know, endorse the vaccination and absolutely recommend it to any member of my family. So if I would recommend it to my family, I would have no hesitation in recommending it to the community. What I want to do is give people an opportunity to ask questions and in the Q&A function. So what we could do just for now is go on to Dr. Ranasinghe's next slot, which is talking about the Healthier Together programme, and that will give us a chance for people to put more questions in. We've got questions coming in, but if you want your question answered, you have to put it into the chat box. So please start asking those questions. No question is right or wrong. It's really important that we address people's concerns, and every concern comes from somewhere, and we don't start at a point where people where we rubbish any myth. We know everything comes from somewhere, so we would love to hear from you what those questions, and it's a real good opportunity to get some expert advice. Dr. Ranasinghe, if I could come back to you, please.
Thank you, Emma. So I launched this program last year with a huge amount of support from colleagues across the whole of Southwest London. I was actually working in Croydon as the paediatric emergency department lead over the pandemic, and the pandemic exposed a number of gaps within our healthcare system, particularly community services that couldn't function during the pandemic, but those gaps were already there. They were just exacerbated. And working in hospital, we see the breadth of everything, your typical kind of GP presentations to very, very sick children. We did see a good number of very sick children, but the overlay as well of economics and social care on health also. So we started this to try and extend the reach of healthcare professionals to children in our population, to try and improve outcomes for children and to try and reduce inequalities in health across Southwest London. So you can get to the website through the web address there, or you can scan the QR code on your phone. And what it links to is a website that has information that's been tailored for our population here, and it covers a huge variety of conditions, common conditions that children will get from birth to childhood to adolescence. And there are also some really great resources for pregnant women as well. And we have all healthcare professionals that are centred around the care of the child. So that be senior paediatricians, GPs, health visitors, school nurses, community pharmacists. They've all come together to produce the professional resources to make sure that each professional that sees any of our children in South West London has the confidence and the competencies to be able to manage them, and that everything links together. So everybody's singing from the same hymn sheet in terms of how we should be managing children as per the best evidence from national guidance and from latest research. And there's trusted information for families. So you can go onto our website, you can search for common symptoms, complaints. There's a huge variety of resources on child welfare, but things like what to do with the fever. It links to national guidance on what you should do with a simple traffic-like system to tell you when you need to come to hospital, when you should be seeing your GP or community pharmacy, and when you can look after your child at home. And the resources that we have there are supplemented with NHS choices, but they are a lot more detailed, a lot more comprehensive, and they will link to local services as well. And we're using this as a platform to shape our healthcare system within South West London. So we're looking at how services are designed and ensuring that they're responsive to the needs of you as families, as children. And where there are gaps, we come together and we look to see how we can remedy that by providing more enhanced services within the community or within a hospital setting. So we really encourage you to look at this, and please share with friends and family. There'll be a lot of work with South West London in advertising this over the winter period, and we're keen to take feedback and how we can enhance the resources that we have on the platform as well. Thank you.
Thank you very much for that information, and you can see the QR code there if you want to learn more about that. Now it's time for a Q&A session, so I'm relying on Aman to send me some of those questions that have come up. I've got a question myself, and it's something that Rachel Flowers, you'll be quite you'll know this to be true. We did a lot of work around the COVID vaccination, and people were talking about home remedies and herbal remedies and alternative therapies. Turmeric apparently is the one I've heard for measles, and turmeric seeds and tamarind seeds and turmeric. Put it in a powder. It's supposed to be good for measles and mumps. Does somebody want to, in the panel, address if there's any truth to that, and generally, should we be avoiding trying out experimenting at home, especially when it comes to young children, when there is professional advice out there? So I'd like to ask one of my panelists, who can I go to for that? I'll open it up to any of you to answer that.
I'm very happy to say that I have no experience using tamarind to ward off viruses. It's not something that I've come across professionally. Certainly happy to kind of look into it, but no, not something that I know is evidence to help.
Rachel.
So I wanted to make sure that our paediatrician kind of had so I can absolutely understand why, you know, kind of like people use different sources of community kind of like alternatives. There's always about the evidence base. Is it effective? Does it demonstrate that it is? I have not read any evidence that actually turmeric or tamarind kind of will actually prevent measles, mumps or rubella, but measles. I think the thing is bearing in mind that, you know, this is a condition that actually you can prevent, you can stop most people catching it by 2 doses of vaccination. It may well be that there are kind of alternative treatments that might soothe some of the conditions afterwards. I mean, we've heard, like a very personal account, thank you for sharing it, about how awful it is to have a sick child around this as well. And I think in relation to this is that vaccination, there's a reason why we don't know very much about measles, is because vaccination works. It prevents people becoming ill. It is the most effective and free way of actually preventing most cases of MMR. There will be some people who will not be able to take the medication for a few reasons, and actually this is why 95% of us should be immunised to protect those people who can't be. That's the whole thing about the spirit of herd immunity, providing protection for the group, for those people who are less able to do so.
Thank you very much for that, Rachel and Darren. I've got another question, which is around which groups are more susceptible to getting MMR? Where earlier on you spoke, Rachel, about targeted groups. Are we talking about targeted groups in terms of age? Are we talking about ethnicity, a certain population in an area? I mean, what groups are we trying to target, and why would they be more susceptible?
So the groups we're targeting in this case are the communities that have less than 95% of 2 doses of MMR. Is that actually in relation to this? So it is about those people who haven't had the protection around this. Kind of as has been said, measles is incredibly contagious. Kind of like within a room, kind of like 90 out of 100 people will catch it, kind of unless they are protected around this. So this is why London, as opposed to other parts of England, are actually really pushing this. Is kind of the conversation I had with the Director of Public Health at Sheffield earlier on this afternoon. Within Sheffield, nearly 95% of all of their population have had 2 doses of mumps, measles and rubella, kind of dose around this as well. So the targeted particularly around this group is for those people who haven't had the 2 doses.
And that kind of goes to my next question. So we've had a couple of questions in. I would really encourage people who've come, made the time to come to this and listen to this. Please do ask your questions. Please make your comments, even if it's not a question, and you want to make a comment. We're happy to read those out and listen to them. I know, Darren, you've put your hand up to come into this, but one of the questions that were leading from what Rachel was saying actually was around why the first dose doesn't provide enough coverage, and why do you need to have 2? Why? I mean, with COVID, we know a lot of people just thought, okay, well, 1 will do. I'm kind of protected. I might not need another one. So why should we go and have a second one? And why can't we just have enough in the first, so we don't have to go through all of that again? I will give the opportunity to Darren at this stage to come in and then come back to other colleagues.
Yeah, thanks. We're really fortunate that we had quite a transparent process with COVID, and so there's a much better understanding about how vaccines work in the general population, and I think that's key to the success of the vaccine programme. And so a lot of people will kind of understand how vaccines work, with COVID, and understanding why they needed more than just the 1 vaccine, and they could see how desperate people were to get their catch-up doses to make sure that they weren't vulnerable, and that they could keep their immunity up, so that they weren't going to be susceptible. And that's really kind of what we're trying to do. Without getting too much into the science of how vaccines work, it's building that immune response within each of us, so that we can maintain that level of immunity going forward in our lifetime. So it varies within each of those conditions that we're vaccinating how effective 1 and 2 doses are, but to get as much vaccine protection for those viruses, you need to get 2. Yeah, I mean, that's the crux of it, I suppose. I was just going to add one follow-up point to Rachel's. Is absolutely echo everything that Rachel's said there about the vulnerable groups being particularly those areas where our vaccine levels are low. Also, clinically, we do target pregnant women because the effects of those illnesses are not just for the individual who gets the virus, unfortunately, but also with rubella, it's for the unborn child as well, and that's something that really is devastating. The long-term neurological complications that a baby would be born with congenital rubella. So that's another part, particularly that we target pregnant women to see if they've had their MMR vaccine, that we would ensure that they are counselled and can access the vaccines too.
Thank you very much. Rachel, please do come in.
So yeah, and just to add, kind of like around this, the secret cool thing about 2 doses of MMR is we believe it gives long-term and maybe lifetime immunity to 99% of the cases, or 80%, as we said before. Unlike COVID or flu, where there is a repeated around this, it's a 2-dose. And then that gives you a very long immunity. This is why, we're very keen to get 2 doses. But once it's done, kind of like for those people around this, there is a longevity, a long time period for people as well. But I would reiterate with Darren, it's kind of like absolutely rubella, particularly protecting kind of like women around the devastation around catching rubella with when they are pregnant.
Thanks very much, Rachel. Do any, yes, Fiona, please do come in.
I was just going to reinforce that the MMR vaccine is really effective, and after 2 doses, get about 99% of people that will be protected against measles and rubella, and around 88% of people will be protected against mumps. People who are vaccinated against mumps can still catch mumps, but it's less serious, less complications, and less likely to be admitted to hospital. Protection against measles, mumps and rubella starts to develop about 2 weeks after the vaccine. So we can't just wait till there's an outbreak and then all rush off to go and get the MMR vaccine, because it will take you 2 weeks before you're protected. And actually, we have got vulnerable patients in the community. We've got children that are having chemotherapy. It's all done from home. They go in, have their treatment and come out. And so you've got vulnerable people in the population, and we're trying to protect them as well. And all of us will know about relatives that are undergoing some kind of treatment, and we need to protect them and our families.
Thank you very much for that, Fiona. Very quick, and don't know if it's it must be an easy question to answer this one. How big's the needle?
Well, actually, I ran the COVID vaccination service, and the needle is tiny. It's not huge. It's very fine because it's given to children, and we still give vaccines to adults up to the age of 45. Are offered the MMR. It comes in a pre-packed kit with the right size needle that we should administer the vaccine with. So, and most people go to their practice nurses and get their immunisations, and the school nursing service also help with those that have missed out with the vaccine. You've got highly skilled nurses that are giving vaccines every single day that they're working. So they have got tactics that they use to try and make it a less painful and distract the children, and also support the parents that are worried about themselves having injections, never mind their children. So if they let us know that they're one of those that find it really uncomfortable to watch, then we can support them. We can get another member of staff to come and help, or they can come along with a friend. Just let us know, and we will try and make it a good experience.
Thank you so much, and Julie, thank you for coming in. Look, you're on mute.
Yeah, just completely reinforcing what Fiona said, but just to add as well that I know parents are concerned there's a porcine gelatin content in one of the MMR vaccinations, but just to reassure people, we do use the vaccine that does not contain the porcine gelatin, if that helps at all.
That does help. That would have been, as a Muslim parent myself, I would have been really concerned, and we had issues. I hope you won't mind me sharing this, but with the flu vaccine, and I know there was a nasal alternative at school for that. So I think if you have those kind of concerns, it's really worth talking to your GP or your doctor's surgery and just finding out, you know, what if there is an alternative and what it contains. Everybody has a right to know what's going to be injected into their child and themselves. So you can ask those questions. In the backdrop, just apologies, I will go back to audience questions, but I had a question with the backdrop of health inequalities, and we know Croydon has them, and most boroughs have health inequalities, and it's come to light after COVID. One of the questions I really wanted to ask is, Rachel Flowers, you might be able to answer this. Which groups fare worse and are likely to have a worse outcome? Is there a particular group who fares worse with MMR once they've contracted it?
Well, mumps, measles and rubella, I mean, I think is, you know, in relation to this, if you've got a large disposable income, a nice house, kind of like clean, kind of like around this, it's a lot easier being very poorly in a big house like that when you're not worried about night shifts or no job or the bills than if you're in a kind of like a say for example a hotel as an asylum seeker. So I think the thing is, you know, in relation to this is that, you know, kind of it's very difficult to tell with this communicable disease kind of like how it's going to impact you. We know that actually the having you know, a kind of a home, a job, disposable income, family support around this will make it more bearable. So there is always a dynamic around kind of inequalities around illness, communicable disease or not. But actually, I mean, we've got a clinician here. I'm a population health specialist. You know, we know there are some people who are more vulnerable, kind of like around illness as well. But certainly, the cases of measles that I have investigated in 2019 is, you know, it was across the board. But I think it's easier kind of like somebody being ill with comfort of a job, a house, you know, no night shift than others, and it is so preventable. So there's always an inequality dynamic kind of like around this. When you're poor, it's harder to be ill.
Well, thank you. And I think our next question is perhaps for Dr. Ranasinghe. Somebody's asked a question around, is the MMR vaccine offered to pregnant women if they haven't had it? And is it safe to give at any time in pregnancy?
Yeah, thanks very much, Elizabeth, because I want to be clear with that. So we want to target the population, and the particular groups that are at risk are pregnant women, because it has an effect on the unborn baby. But because it's a live vaccine, we can't give it within pregnancy. And so that's the issue. And that's why it's timed in such a way that we give it to the population at the earliest opportunity, because we can protect people at their most vulnerable when they are children, and prevent them from passing it on to their babies when they're older as well. So I hope that clarifies that. And I think the other question was that a follow-up to it as well.
Yeah, I think there was a follow-up. Yeah. So it's from a different person. So there seems like there's concerns around the maternity and pregnancy issue in the chat. So Alexander, Charlotte has asked, is it correct that women should wait until after their second MMR vaccine before getting pregnant if possible? Fiona, you've put your hand up.
Yes. So to answer, or to carry on answering the question around MMR during pregnancy, it's not recommended, as we've already said, and you should also avoid getting pregnant within a month of having the MMR. It is best to let your midwife or your GP know if you've have the MMR during pregnancy, because often people go on holiday, come for travel vaccines, and have the jab, and then they discover when they come back from holiday that they've actually become pregnant. It's not going to cause you any harm, so the evidence suggests that there's no harm to the baby, but it's better to let us know. With regards to having the MMR, we always advocate that people that haven't had the MMR as part of preconception care to have the MMR if they've not evidence of it, because we know that it's circulating. Measles is circulating, or rubella occasionally will circulate. So you're reducing your risk of your child being born with an abnormality or you becoming unwell. So we say have the vaccine but don't get pregnant for 3 months. So you can do that in your planning. And we talk about that to certain groups of patients. I think also in schools they have some health education around vaccinations and pregnancy and contraception. So these questions might come up and then we might get clarity on that. The other thing is that the maternity services don't screen for rubella anymore, antibodies. So they don't routinely offer you MMR post-delivery, which they used to do, which was really handy for us. So they don't do that now. So it's up to the GP practice to offer it. So we do offer it to people because a pop-up will come up saying, have you had your MMR1? Have you had your MMR2? And we've got lots of people that come from abroad. If they've got no evidence, we will re-immunise them if they can't find a record or they weren't quite sure, just to give them protection, because not giving a vaccine is a greater risk than giving an extra vaccine. And that's what we advocate. We have got a process that we can follow, and we will immunise. And just as an antidote or a comment, I've got 4 children, and one of my sons decided he used to sign his own consent forms for school vaccines, and he had the MMR 3 times. Because he signed it, and there was no side effects, no localized reaction at all. So having additional doses doesn't cause a particular problem to most healthy children. And also, if you travel under the age of 1, you might be given the MMR in an endemic area, if that's where you're going on holiday. And then once you've reached 1, you will get your first dose, and then you will have to have the second dose. So you'll have 3 doses, and then lots of children that have had 3 doses, and it causes them no harm at all.
Thank you very much, Fiona. Unfortunately, we're losing Rachel Flowers as it's day she needs to leave, but thank you so much, Rachel Flowers, for your contribution. Really informative as always, and I look forward to the next time we're together on a session. Another question is around how measles can be prevented. So specifically, it looks like around measles, can it be prevented?
Yes, with the vaccine.
Yeah, with the vaccine,
Fiona,
I was going to say the same.
Simple answer to that, and also if you've had it once, you obviously can't get it again. Is that right?
It's very rare to get it again, but of course, if you've had treatment like chemotherapy or other treatments, you might have lost all your immunity for that vaccine, and we have to revaccinate you. And sadly, occasionally people do get exposed to viruses and become quite unwell, and they're already immunocompromised. So we do, when they're well, we do revaccinate high-risk children that have completed treatments like chemotherapy, so that they've got immunity going forward.
Thank you. And another question was, if you've got measles and you develop immunity, do you get immunity for the other 2? So do they come as a triple, or because the vaccination is a triple? So how does that actually work? It's a good question, I think.
Can I just clarify that? So if you get measles, you say, as an
Yes.
infection without having had any vaccine?
Without any vaccine, so if you've developed immunity from naturally, do you develop immunity for the other two naturally?
No, so they're completely separate viruses. So you would have to be hopefully vaccinated to prevent them.
Thank you. Joining us on the panel, I see is Hilary Williams, who is give me your introduction fully, because I'm not sure what your full job title is, but you're from the NHS South West London, and you're, I believe, the director of the One Croydon Alliance.
Thank you, Emma, and good evening, colleagues. My name is Hilary Williams. I'm the Interim Director of Transformation and Commissioning for Croydon Place, part of the South West London Integrated Care Board. So I'm here because obviously I'm really committed to population health, really committed to the health and well-being of the Croydon place, but also know that there's some specific concerns that we have amongst citizens in Croydon, and really wanted to be part of this webinar to make sure that I'm hearing the messages. So in all of the relevant forums that I'm in, that I can kind of relay, you know, using evidence, picking up on Rachel's point earlier and Darren's point earlier about, you know, being evidence informed, knowing what the data says, knowing what the science behind things are saying, so that, you know, we're consistent in our approaches, but also just to understand what some of the concerns from people are, and you know, how we can support people address some of those concerns. So I know a lot of people are here to support that process. So I can see Fiona, you know, you've made the time out of hours as well. So I just want to say thank you, really, and to keep the questions coming, because I think it's you know, it's through talking that we can start to progress things. So thank you, Emma.
Thank you so much, Hilary. Really appreciate that you've come in your evening to support this particular session. So thanks for coming on. I have another question, is around can you get the MMR and flu jab together? Winter vaccines are around the corner, so people can people just get them both together? You know, finish the job in one day. Fiona's going to answer that one for us.
So yes, co-administration. Yes, you can. You can administer the flu vaccine with the COVID vaccine, as long as it's in different arms. You can have the flu vaccine with pneumococcal vaccine or shingles vaccine. There's no reason that you can have can't have the flu and the MMR when you go and see your GP if you're missing those, for children or adults.
Thank you very much. Another question here is about the long-term side effects. So we did hear a little bit about side effects earlier on, but somebody wants to know what the long-term side effects of the MMR vaccine is, and would the side effects last longer than just a sore arm and mild flu symptoms? Were you playing it down, Dr. Darren, or actually is there a chance people will be fare much worse and get worse side effects?
So when we talk about side effects, it's not a personal view that we give. There's an extensive process of evaluating any vaccine, where we look over many years over all the doses given, what is the actual safety profile, and all the side effects that we experience. So there's a national log to report all of these things, and we group these into there being common by the number of them, and then whether they're rare and very rare complications. So Fiona's put a link up within the chat that I think you can all see. So as I was saying, we've picked out the commonest side effects that we routinely would let parents know about when we're giving the vaccines, but there's more extensive information within those links. On the link that we highlighted as well, that links to the Oxford University vaccine project, it itemises all of those risks as well. So it's all going to be within the product information of whatever vaccine you're given, but it is all there clearly displayed. We're not hiding anything there, so please do have a look at it, but do kind of look at it in the context of, you know, that piece of work that's done, evaluating from many years of experience, both in the UK and throughout the world, millions of doses given, and, you know, what is a common side effect that your child's likely to have, and what is a potentially serious and long-lasting side effect, but is very rare. Because that's with any drug that we would give a child. There are side effects, but we have to look at them in terms of the likelihood as well as the severity.
Fiona.
I was just going to raise one of the very rare side effects is anaphylaxis. So that's an allergic reaction to a vaccine, and that's always a potential. But all health professionals have an annual update to deal with anaphylaxis. We know how to recognise it. We know how to deal with it. We all have adrenaline available to counteract the effects of anaphylaxis. That adult child will be taken to hospital and assessed. Anybody who's had an allergic reaction to a vaccine and still wants to go ahead and have the second one, they can go and have their second vaccine under a controlled environment and observed in hospital. And for some patients, it's really important that they have that protection. So they go into hospital, maybe into a clinic, and they're observed and they have their second vaccine if they need it. But all clinicians are all kept up to date with the anaphylaxis, resuscitation, and we all have adrenaline to hand whenever we're immunising. In fact, if we go on a home visit or if we've got a clinic, it's always to hand. So people can be reassured of that. And children that do have anaphylaxis will have EpiPens anyway, because you never know when you're going to have reactions. And we know it's not only to vaccines, you know, peanuts, other things cause allergic reactions, but people know how to deal with it.
Thank you very much, Fiona. I've got a couple more questions to ask, and then we can wrap up. So, are there tests available to diagnose rubella?
I can help you answer. There are tests available to see if you've got antibodies to measles, mumps, and rubella, and that's to find out if you've had previous exposure or have been vaccinated, and you've got those antibodies. So there are tests, but we can't use that, just the screen, to see if people are being exposed so that they can't have the vaccine, because you don't know how effective and what level of antibody response they've got. So you would still need to have a vaccine. You can't opt out of having a vaccine, really. You can choose not to have a vaccine, but that's an informed consent that you make a decision, and every parent has got a right to make their own decision for their child. And then when that child becomes an adult, they choose their own decision. So we all often have young adults that come along and say, I didn't have the MMR because my mother didn't believe in it, but I'm travelling somewhere and I'd quite like to have it. And as long as they're Gillick competent, we will give it to them because they've made their own decision and they're over the age of 16.
Thank you very much. A couple more questions around if your child has been exposed to measles or mumps, what should you do? And is it okay just to, if they've been exposed, to take your child to public places like grocery stores, daycare, and playgrounds? What should you do, and can you still take them about?
I can start answering that, and maybe Darren will chip in.
Yeah, sure.
So if you have been exposed and you haven't had the MMR vaccine or the measles vaccine, rubella vaccine, there is a very small chance that you could, from that exposure, develop the disease, and you will become symptomatic. But if you've been fully vaccinated, you can be rest assured that you've got very small risk of actually getting the disease, and that's why we vaccinate people.
So can you vaccinate once you've got it? For example, if you've got signs and symptoms and you got your vaccination booked in, do you get a vaccination at that stage?
No, what signs and symptoms of what? Of disease?
Of one of those diseases, say measles.
No,
Okay.
you wouldn't, because somebody who's unwell, we would never vaccinate. Anybody who's got a temperature, been unwell, had recent chemotherapy or treatment, we wait until they're better, and no temperature within 48 hours. So no, you wouldn't. And remember, it takes 2 weeks to confer immunity. So it's still worth it. If you haven't had the MMR and then you've got a relative that you've been to and they've got measles, go and have the MMR, because you get a bit of protection. We don't know how much, and it might be less severe because you've got the antibodies. You won't have full protection because it takes 2 weeks, but we don't know how people's immune systems work, and everybody's different.
Fantastic, thank you very much. And I am really sorry that we're going to wrap up the Q&A now, and I think we've done fantastically well and answered lots and lots of questions. If people have other questions, then do pop them in the chat, and they can be answered at a later, I'm sure they'll be taken away and answered at a latest stage. So just before we wrap up, I'd like to go to our second poll, if that's possible. Aman?
Yep, I will put it live now.
Thank you. I'm conscious that a few people have dropped off because, and I was really surprised actually, people stayed right to the end, which is absolutely fantastic. And it's kudos to our panel who've kept this really informative. So the question is, following the information received today, will you now choose to vaccinate your child? I'm conscious that a lot of people did have 2 vaccinations already, so clearly the answer on your end is yes. But would you consider vaccinating your child after the very good information that you've received this evening? So far, we're getting 100% of people saying yes, they would, which is fantastic. I'd really encourage others to come in. There's still 20 of us in the room, and we have a low number of answers, so please go ahead and vote. Great, it's starting to go up now. We're almost at 50% of answers. I'll give you 10 more seconds to press that button. It's a simple question. Following the information you've received today, will you choose to vaccinate your child? If you're unsure, say you're unsure. If you're going to do it, just press yes. All right, so we conclude at 100%, so that's absolutely fantastic. Well done to our panel, and well done to our audience for sparing time this evening. I'm sure the information you've heard you can pass on to others, at least pass on the link for reliable sources. And if there's any myths that we've bust tonight, I think the most compelling of that must be the autism one. And it's all the information is so accessible, and the programming Croydon is fantastic. We've heard how you can access the programme, and we've heard from really qualified individuals about detail around all 3 diseases. I'm sure you will all share my sentiments in thanking the panel for sparing their time this evening. Thank you, Elizabeth, you're clapping. And I want to say thank you again to our audience, and there are going to be others, I'm sure, events where you can find out more information and get involved. Thank you, Daniele, for attending. He's just popped a comment in the comments. So I will wrap up with that and say that I hope you all have a very, very good evening, a very good week, a very good month, and go get vaccinated, your family, and if you haven't, and if you have concerns, please do ask. Thank you very much for attending this session, everyone.